Bismillahirrahmanirrahim. I'm Dr. Iftikhar. We'll talk about something which you are supposed to do as a junior doctor from day one actually, and that is writing the prescription. And the prescriptions are of two types, as you know. You write a prescription for an outpatient who will come, get some sort of medicine and just go away. But what we are talking about today is really writing a prescription for an admitted patient. So your patient is an inpatient. So he's admitted, so you have got a drug chart or drug cardex, whatever you card it, right? In various hospitals, this is known as drug chart, drug card, drug cardex, etc. So how to fill it properly? Because we are really dealing with dangerous chemicals called drugs, medicines, right? And while they can be very useful for the patient, but given incorrectly or in different doses or in wrong doses can be very, very harmful. So it is very important, our whole sort of the exercise of looking at the patient, evaluation, investigation, treatment, ultimately sort of depends on how we are sort of delivering these things. Because if we are committing big mistakes, and then the patient pays dearly for it, right? Now, when you are filling in a drug cardex, there are many things that you need to be sort of very careful about. The first thing is, when filling a cardex, writing a new drug, making a change, and for the nursing staff, if they are doing the drug rounds, that is, they are dispensing the drug, please make sure you have got the right cardex in your hand. The patient is right. It's not, the cardex does not belong to another patient. So you do not dispense wrong medicine to the wrong patient, right? So it is very, very important. So each drug cardex has a section, as a column at the very top, as you can see there. It has got a column where it tells what's the patient's name and MR and age and sex. So these are the three absolute minimum parameters that you confirm. That patient is Muhammad Aslam. He is 43-year-old male, right? Still better. It's not sort of that's not how, it's not fashionable in our country because people do not know most of the time their date of birth. But in most other countries, it's a legal requirement that it should be a date of birth that you connect with the patient's name, right? And finally, the MR. So three parameters of confirmation that the patient is Muhammad Aslam, is 45-year-old male, and the MR is, for example, NMC 33946, whatever the series is. So that is very important, first of all, that this is the right drug cardex that you are writing, you are making changes in, or reading that you are giving it, dispensing the medicine to the right patient. The second thing is that each drug cardex must contain section, and that must be properly filled, about special instruction which are prescription related, relevant to that very patient. For example, the first and most important thing that is almost always there is allergies. It must be entered. You need to ask during clerking of the patient, does patient have any allergies? And it is not enough that you sort of document that in your history section. You have to reproduce the same on the drug section as well. So you must write, because this is where that allergy bit is being used. If the patient is allergic to, for example, paracetamol or amoxicillin, then it should come here, because this is where that bit of information is going to be used. So any allergies. Similarly, if the patient is pregnant, you must write that the patient is pregnant. The special precautionary note in maybe red color should come here that the patient is pregnant, right? Because in pregnancy, you know that various things are forbidden, or you need to have sort of dose modification. Similarly, if the patient is, for example, called renal impairment, you must write, do not use NSAID, do not use nephrotoxic drugs. These special instruction related to this very patient must come on cardex, and in bold and preferably in red color, so that it immediately catches your attention or attention of whoever is writing the drug cardex, making any addition or alteration or dispensing drugs based on this drug cardex. And the third thing is that sometimes the instruction, like for example, don't use the left arm. For example, if patient has had and mastectomy on this side, there's a risk of lymphedema. So it is generally advised that you do not use the left arm, right? Or, for example, patient has got a renal impairment and requires an AV fistula, which we are planning to sort of make on the left side. So these instructions should go on the drug cardex. So I rapidly tell you that what is happening is that identify that this is the right drug cardex that you are making changes in. Number two, make sure that patient prescription related informations are written on the drug cardex front face. So before you do any change, you write any drug, you make any alteration, you know that patient is allergic to such and such thing, patient is pregnant, patient has got renal impairment, patient has got hepatic problem, or whatever, right? Or you should not use, for example, left arm or right arm or etc. The third thing is always ensure, because a patient who is staying for a longer period of time in hospital, in the patient's file, sometimes there are 3, 4, 5 drug charts. Make sure you are using the current drug chart, right? It is a mistake that patient needs, for example, new antibiotic, and without noticing, you did write the prescription for a new antibiotic, but in the previous drug chart, and nursing staff completely ignored it because that was the cancelled drug chart, right? So it is important that you make sure that you are using the current drug chart. For that, there has to be a start date, the start date of this chart, right? And you can notice that it's the ongoing drug chart. And the most important precaution that prevents this mistake is that whenever you write a new drug chart, always cancel the old drug chart. Just very boldly draw a big bold line across that and write cancelled, right? So write cancelled all the way across so that we know that this is not the currently used drug charts. So these are important things. And the next thing is that you need to notice that drug charts generally have 3 sections of prescription. I mean, there's obviously a section that we have already discussed which relates to which patient it belongs to, about the special instruction about that patient, whether he has got allergies, etc., etc. But the prescription itself is divided into 3 sections. There is a section of regular prescription. So you write those medicines which are given regularly. For example, you are giving injection ceftriaxone 1 gram BD. So it's sort of going on, it will go on for some days, some doses, 3, 4 doses. Patient is taking diclofenac for pain on a regular basis. Patient is taking omeprazole for his stomach protection. So that is a regular section. Then there is a section which we call a PRN section, as per required. It's very same to the regular section, but it's separate. So that the nursing staff knows that this is a regular prescription and this has to be dispensed on the given time, right? But this is the PRN. So this is as per required medicine. For example, pain medicine, top-up pain medicine, top-up medicine for nausea and vomiting, for constipation. So they are occasionally used. They are sometimes used, they are sometimes not used. So PRN section and regular sections are separate. And then finally, at the very end, we get what is called a once only prescription. Once only means you just have to give 1 stat dose. For example, patient is to be operated tomorrow, and today you decide that okay, at night he should have some maybe 0.5 milligram of alprazolam as an anxiolytic. So that is how the regular section, and now this is the PRN section, and then once only prescription section. Just 1 single doses, right? So this was about the drug chart itself, its structure. We need to identify various drug chart areas and make ourselves well versed with that before we start writing the drug chart. Now we come on to, if you go to the regular section, please. Now have a look at the regular section. When we go to the regular section and you want to write a prescription, you really write prescription of any medicine in 5 definitive steps. So the first step is that you write the drug name. You write the name of the drug, right? The name means, now this itself contains 3 components. When you are writing name of the drug, you have to write 3 components. That would be, what is the formulation? What is the actual drug? And The third thing would be that what is the strength of that drug, right? I give you an example that, for example, you write that, okay, I want to prescribe tablet paracetamol 500 milligram. I want to give 500 milligram paracetamol tablet to this patient, right? So that is how you write. Or there can be sort of, for example, I want to give capsule amoxicillin 250 milligram strength, right? Or I want the patient to take seritide inhaler 25 by 250 microgram, right? So this is what you are going to write. So you have to write the formulation. Is it a capsule, injection, syrup, suppository, whatever it is. So it starts with that, goes on to the drug's name. Now whether you write the generic name or the brand name really depends on the local circumstances. For example, in our set of circumstances, we hardly ever write generic, right? In the UK, it's almost always generic, right? But in this case, if many of the doctors, many of the nursing staff, they are not even versed with the generic name. So write whatever is the convention, whatever is the tradition, right? So you can use both generic and brand name. So you can write tablet paracetamol 500 milligram, or you can write tablet Panadol or Calpol or Fabrol, whatever, right? So this is the first thing you write. You write the drug's name, but drug name contains three components. It is the formulation, name, and the strength in it. This is the first thing. The second thing that you do is that you write the how much dose you want to give. Now this only tells what is the strength of each tablet. The second thing is how much dose you want to give, right? So dose can be written as, for example, it can be 2 tablets. 2 tablets of paracetamol 500 milligram each, which means that you want to give 1 gram of paracetamol, right? Or you can also write that if it's a syrup, 1 tablespoon, or for example you are giving lactulose, so you can say 30 ml, right? So it varies really that how much you want to give. So you write the name, you write the dose, and dose should be written with the units. So it can be 2 tablets, 1 capsule, 1 tablespoon, 30 ml, 50 milligram, whatever, right? So as the name should be written with along with the formulation and the strength, similarly the dose should be written with the number and the unit. I want to give 2 tablets, 1 capsule, 3 teaspoon, 30 ml, etc., etc. The third thing that we write is frequency. How often? How often? I want to give 2 tablets of paracetamol, but how often? And you know that there are certain codes that we use, and doctors really sort of connect very nicely with it, and nursing staff know that as well. So commonly used frequency terms are, for example, OD, which means once a day, or it can be BD, which means twice a day. Now BD is written as BD and BD is written as BID as well. Or it can be TDS or TID, which means thrice a day, or QDS or QID, which means 4 times a day. Or it can be HS, our somnolence at the time of sleep, just before going to sleep, right? Or it can be SOS, as per required, which is also written as PRN, as per required. So these are the various sort of frequencies that you can use. There can be other as well. Sometimes if the frequency does not fit in sort of these predetermined frequencies, you can write it separately. For example, you can write 4 hourly. Now none of this shows 4 hourly, so you can separately write 4 hourly or every hour, right? So this is the third thing that you write. We write the name, the dose, and the frequency. And the fourth thing that we write is the route. How this drug should be given. Now it is obvious that tablet and capsules will be given orally, but you need to write it, you need to document it. That is how you want the medicine to go. So things can go sort of orally, in which case it would be PO, that is per orum, right? Or it could be per rectal, for example, like suppositories. It can be BV, vaginally, like antifungal tablets are given vaginally, right? Similarly, if the parenteral drug is being administered, it can be subcutaneous, it can be intramuscular, IM, or it can be intravenous, or it can be IVI, intravenous infusion. Now, there's difference between IV. IV means that you have got sort of an antibiotic or an injection of 2 ml and you give it into the vein, right? But IV infusion means that you have to dilute it and give it over a period of time in a diluted solution. So IV infusion and IV is different. So these are the various routes that you can use. Similarly, medicines can be given, for example, in addition to that, they can be nebulized, or they can be given as inhaler, so INH, or they can even be given topically, like in dermatological preparation, right? Steroid cream or ointments and stuff like that. So we have written the name, right, the dose, the frequency, and the route, and then the final thing would be special precautions or special instructions, let's say. Special instructions can be very or many. For example, if you are prescribed anti-tuberculosis treatment, you may be writing before meals. So it has to be given before meals. Or even more elaborate than that, 30 minutes before meal. Right? It can be 30 minutes before meal. Or if you are prescribing sort of NSAIDs, you may write that after meals. Right? Or for example, if there is a medicine that you want to give in an infusion, you can write that, okay, dilute it and give in 100 ml saline, in 100 ml saline over 15 minutes. So these are various sort of instructions that needs to go on. So just to revise again, that once you have identified that this is the right patient's cardex, this is the right patient's chart, and then making sure that there are no special instruction on the chart to say that you have to be careful because the patient is pregnant, he has got renal impairment, or patient has got some special allergies or etc. going on, and to ensure that you are using current chart and not by mistake using an old chart of the patient, right? So and you use the right section for regular prescription or PRN prescription or just one-off stat dose prescription, then this is how you write a prescription. These are the 5 parameters you must write. So the first most important is the name of the drug, but name of the drug has got 3 components. What is the formulation, what is the name, and what is the strength. So tablet paracetamol 500 mg, tablet Panadol 500 mg, because you know Panadol Extend is also available in 375 mg. So you need to tell which paracetamol you need and how much. What is the dose? Do you want to give 1 tablet, 2 tablet, 30 ml, 1 capsule? What? Right? I mean, then again frequency. How often? Do you want to give OD daily, BD that is twice, TID thrice, QID 4 times a day at the only bedtime, whenever is required, 4 hourly, etc. Then we have to determine the route, right? Does it have to go per oral, PO, or rectally, or vaginally, or subcutaneously, intramuscular, intravenous stat injection, or intravenous infusions? Does the medicine have to go through nebulization, or inhaler, or topical? There can be other as well, but these are the most commonly used. And finally, is there any special instruction? The patient must not take it on empty stomach. Patient must take it on an empty stomach. Patient must not take it with X drug, right? Or for example, it should be diluted and should be given such a period of time. It should not be given in less than 1 hour, or should be given over 15 minutes or so. So these are the various things that you have to look into. Now the next thing is, which is very important, that these are the 5 parameters that we must write before you can sort of say that it's a safe prescription. Now if you have to change anything, for example, patient had injection ceftriaxone 1 gram going BD intravenously on a regular basis for last 3 days. Now you decide that I want to change it. I want to just make it once a daily and not twice a daily. Now what is important is that you must not do that correction here, right? If it is already written injection ceftriaxone 1 gram BD intravenously, you cannot sort of just cut BD and make it OD, because that is a problem. If you have to do audit, if you have to go back and see okay, how many days patient received a BD administration and then went on to OD, that would become very difficult, right? So the general instruction is that if you are making any change to any of these 5 parameters, you really need to cross off that and rewrite it, right? Cross off that prescription, cross off that drug from there. For example, you are giving tablet paracetamol 500 milligram once daily, thrice, 1 tablet thrice a day. And you want, no, I now want to give 2 tablets thrice a day. So it's very easy to make 1, 2. No, that is wrong, because then I cannot tell you how long patient took 1 tablet and then when did he start taking 2 tablets. So you have to cross that off, and in the next sort of row, rewrite the drug with all these 5 parameters all over again. So this is very, very important, that any of the change in any of the 5 these criteria or parameters means crossing that drug off and rewriting it. Now when you cross the drug off, that too must be done in a very effective way. You really need to cross it off. You really need to sort of put a line there, put a line there, and do that, so that there's no doubt that this has been crossed off, right? And finally, please beware, be careful. Medicines are dangerous things, they are dangerous chemicals. So please make sure that you do not make mistakes that bring big bad consequences. And this is especially true if there's possibility of confusion is high. So there are 3 or 4 things that I especially want to tell you. First thing is legibility. Sometimes drugs names are very sort of close together. If you are not careful, you can sort of write no, actually this is digoxin and this is diagezic. But nursing staff can make a mistake, right? It's very difficult. People have very scribbly handwritings. If you have got problem with your handwriting, please do in blocks, right? Like sort for example, digoxin 0.25 milligram tablet. Write in blocks, right? Do something about your handwriting. You need to be very clear, precise about it. The second thing is, this point thing is very, very dangerous. People sometimes miss it. I mean, writing 0.25 milligram, sometimes the point is not very clearly visible. You need to make it visible, and the easiest way is whenever there is a point, make sure you put a 0 behind it, before it, so that everybody will now understand 0 means nothing, right? But this 0 makes point very clear. And number 3, if there is a digit that you specially want to draw attention to, that there should be absolutely no mistake, right? Put it in a circle. For example, you want to say 3 tablets and you want to be absolutely sure it has to be 3 tablets, do that. Right? These are small little tricks. And finally, there is usually a mistake between milligrams and micrograms. Please make sure that you write milligrams and micrograms clearly. Sometimes people write microgram, sorry. So it is sometimes very, very unclear what you have written. So please clearly write down milligram or microgram. So this is how we write safe drug charts, right? So these are the various steps about the drug chart itself, and then 5 parameters that you have to fill about the medicine that you are prescribing, and then few instructions that you need to be especially be wary of so that our patient remains in safe hands. Okay, so I hope you enjoyed it, and I hope you and your patient will benefit from it.